Good morning, doctor, and all my classmates. We are Group 33. I'm Xiaoyan. Now, let me give you an introduction about our topic. So, our study is on the dissemination effect and the audience health literacy of HPV short video based on the TikTok platform. So, we can see HPV, the full name is human papilloma virus. It is the most common virus infection, responsible for around 630,000 new cancer cases around the world each year. Recognizing its high prevalence and severity, many national programs have been implemented to promote HPV vaccination, which helps protect against HPV transmission and cancer development.
Despite the efforts, the HPV vaccination rate remains low globally, particularly in less developed regions. Recent studies have identified social media as a promising tool for strengthening HPV vaccine confidence and increasing vaccination rates. As a significant source of health information, social media, particularly TikTok, now plays a crucial role in educating the public about HPV, shaping attitudes and influencing behaviors toward HPV vaccination. Well, about 69% of all TikTok users are between the ages of 13 and 24 years, making it an ideal means of reaching the target population. That is a priority for HPV vaccination. My teammate will introduce the problem statement.
Okay, let's move to the problem statement. Even through the increasing prevalence of HPV and the availability of vaccines and numerous educational campaigns, the public's level of awareness and understanding of this issue remains inadequate. Traditional health education methods often struggle to effectively engage and inform different audiences, especially younger populations who are at higher risk. So, the study problem is how short form content, like TikTok videos, influences public understanding and health literacy about critical topics such as HPV. As Xiaoyan mentioned before, TikTok has become a popular medium for disseminating health information because it offers a unique opportunity to re-evolution information dissemination through short, engaging videos that can quickly reach and educate a wide audience. Many individuals remain unaware of the virus, possess limited or incorrect knowledge about its risk, or fail to adopt the recommended preventive participant. Therefore, our study aimed to investigate how HPV-related TikToks videos influence public awarenesses, enhance knowledge accuracy, and promote preventive practice such as vaccination and screening. Specifically, we examine whether these videos succeed in transforming passive engagement into informed decision-making and proactive health behaviors. By analyzing audience engagement, content dissemination, and changes in audience knowledge and attitudes towards HPV, this study can reveal the potential of TikTok as a medium for public health education.
Okay, thank you for your sharing. I will be presenting a literature review on how social media platforms are used to promote HPV vaccination and raise awareness about cervical cancer. This table summarizes 10 studies, highlighting their topics, methodologies, key findings, and research gaps. Firstly, an observation study compared Instagram and TikTok in disseminating evidence-based cancer content. While TikTok achieved the highest reach, Instagram excelled in engagement and impressions. However, a lack of longitudinal data limits our understanding of user behavior and interventional efforts. The second study analyzed 163 short videos on TikTok and Quai, finding that videos posted by specialists scored higher in quality metrics like GQS and design. Despite this, the study didn't assess the long-term effects of these videos on healthy knowledge or behavior changes. The third study, a cross-sectional survey, revealed that higher health literacy positively influenced adults' awareness to vaccination. Yes, it didn't explore how this translated into actual vaccination behavior. An experimental study found that videos with high information quality and credibility significantly improved attitudes toward HPV vaccination. However, it was limited to a specific demographic, Chinese female students, restricting its generalizability. Lastly, a cross-sectional study of 100 TikTok videos reported that 75% discussed HPV-related topics, while comments were often neutral. The study lacked a broader perspective and longitudinal analysis.
Then let's move on. I outlined 5 studies on the topic as well. The first article, wrote by Etta and Alkby, evaluated the quality of health information about HPV on TikTok through content analysis and found that the quality of most videos was low, especially the quality of user-generated content. The second article studied user demand for HPV vaccine information through chatbot technology, highlighting the impact of social media on consumer decision-making, but also pointing out that health information is vulnerable to misinformation. The third one analyzed the spirit of HPV vaccine on TikTok and found that the pro-vaccine videos had less interaction, while anti-vaccine videos received more attention. Then a survey by Globerman, which examined mothers' changing attitude towards the HPV vaccine after the COVID-19 outbreak, noted that TikTok played a positive role in reducing negative attitudes. Finally, Morton studied the impact of racial and ethnic differences on the spirit of HPV information on TikTok, indicating that white women dominated content creation and creators of different racials favored different types of health information. This study shows that despite the potential of platforms such as TikTok for disseminating health information, there are significant differences in access to and acceptance of information among different groups. Future research should explore in more depth how to improve the quality of information and reduce misleading information on social media.
Next, I'm going to talk about the research gap and a part of methodology. We can find some limitations from previous study, including a lack of engagement with user-generated content, a failure to explore the long-term effects of videos on health behavior, and the limited sample diversity. Additionally, previous research paid less attention to the short videos format emerging on social media and the exploration of its specific impact on persuading people to get HPV vaccination remains gap. Considering these limitations, our study will apply the theoretical lens of uses and gratifications theory to test the potential factors of TikTok videos that may influence people's attitudes and intentions to HPV vaccination. By applying qualitative method with group discussion with a diverse sample, we aim to assess how these videos shape intentions and the actual health behaviors, such as HPV vaccination uptake. The study will also consider interactive elements like users' comments and engagement in the video's effectiveness. Unlike previous studies, our research will include a broader and a more inclusive demographic. This can help to get more comprehensive understanding for TikTok's role in public health education.
Okay, thank you for your sharing. So now let's move on the theoretical framework. So I'm gonna talk about the theory of the study used. The theory used in this study is the uses and gratifications theory, which we call UZT. It assumed that individuals actively seek out media to fulfill specific needs, such as information, entertainment, or social interaction. The application of UGT in this study is crucial for assessing how users' motivations impact their perception of HPV-related content and its effectiveness in promoting health literacy. This theory demonstrates how TikTok users seek and engage with HPV-related short videos to fulfill their needs. So the first one is the cognitive, which refers to learning knowledge about HPV. The second one is affective. It is emotional connection or entertainment. The third one is social integrative needs. It means sharing and interacting with others. And the last one is tension release. It's relaxation or escapism. These needs drive user selection of content, such as educational or entertaining videos. Gratifications obtained from the content include increased dissemination, such as through likes, shares, and comments, improved audience health literacy, like knowledge and critical evaluation of HPV information, and the potential behavior changes, like some practice their intention to get vaccination. So in this research, the conceptual framework will focus on how independent variables influence the non-dependent variable, which is the audience health literacy. We have three areas. The first one is the user motivation, as I mentioned before just now. So the second one is creator information. We will focus on the credibility of the content creator, like healthcare professionals, influencers, or general users to influence the audience trust in the content. The last one is content characteristics, such as video format, value appeal, knowledge points of HPV, and the resonance attitude. They determine how well the information is delivered and received by viewer. Audience engagement mediates this relationship by capturing the extent of interaction with the HPV videos, such as views, likes, comments, and shares. Higher engagement level indicate deeper processing of health messages. This kind of process can enhance audience health literacy, improving knowledge awareness and behavioral intention, such as considering vaccination or adopting preventative health practice. Okay, that's all for our presentation. Thank you for your listening. And here is our references. Okay, bye-bye.